Hi, my name is Dr Ben Kroon. I'm one of the obstetricians here at Eve Health. I've got Natalie with me, who's kindly agreed to be our little model. She's clearly got a beautiful 26-week belly. So for an antenatal visit, what happens is that whenever you see one of the obstetricians at Eve Health, you'd sit down and have a talk about your general health, how you're feeling, what baby's up to, is baby moving, whether there are any problems, anything that's happening that you're concerned about. The doctor would review your scans and any blood tests and then check your blood pressure, and then would come to examining your tummy. So every room at Eve Health has an ultrasound scanner, and your obstetrician will always examine your belly and also perform an ultrasound scan to check a variety of things: the position of baby, size of your tummy, maybe measure baby's estimated weight, look at the fluid around baby, check the heartbeat. So I'm just going to run through what that looks like, because we've got such a perfect model here. So we'd always feel initially to see what's coming first, whether there's a head coming first or a bum coming first. Might feel for what position baby's lying in, whether we can feel a back on one side, and how much fluid it feels like is around baby. Often you might find your obstetrician measures your tummy, which seems like a really strange thing to do, but what we know is that approximately the number of weeks you are equals the number of centimetres on a measuring tape. So about 26 centimetres, about 26 weeks approximately. Obviously there are other ways of assessing that by using an ultrasound. This is just some warmed jelly. What we'll see here, and we've always got screens up on the wall, is a baby with a little head. Now I don't know if you can see that. Little heart beating away here. Sounds cool, right? All right, so we can measure the heart rate. So what we're looking at now, we can see the spine down to baby's bum down here, and then there's beautiful fluid, which we always measure, because it is an indicator of how baby's going, how baby's kidneys are going. One of the things about antenatal visits that's different to other visits is that usually antenatal visits are fun. Mum's excited because there's a baby growing, they're feeling good, baby's moving, it's great to see baby on a scan, and usually everything is going well. Obviously sometimes things aren't going well, and that's the whole reason for seeing an obstetrician, because you get that obstetrician to detect if there's a problem with you or a problem with baby. And if that happens, obviously your visits become longer, they become slightly more complicated, but that's our job, is to look after you when things go wrong, and when there is a reason for us to deliver a baby early or change the plans for delivery.